Hello, how are you all? Hope you are fine, preparing well for the AMC Part 1 examination. There are some questions from the Gynae section which will clear your confusion. So let's start without any delay. 29-year-old woman with a past history of pregnancy with an anencephalic fetus present to your clinic for pre-conceptional counseling. Which one of the following is the most appropriate advice regarding folic acid supplementation for her? A. She should use supplemental folic acid 0.4 to 0.5 mg per day. B. She should use supplemental folic acid 10 mg per day. C. She should consume more green vegetables. D. She should use supplemental folic acid 1 mg per day. E. She should use supplemental folic acid 4 to 5 mg per day. So this is incorrect option because we have to have prescribed folic acid to every pregnant woman preconceptionally as well as antenatally till 12 weeks is the requirement in the first trimester, because organogenesis, the fetus organs are usually developed in the first trimester of the pregnancy. So it is requirement to prevent neural tube defects to prescribe folic acid to every pregnant woman preconceptionally as well as antenatally in the first trimester. So what's the dose? The normal dose is 0.4 to 0.5 milligram or 400 microgram to 500 microgram is the normal dose of the folic acid. But here is the twist, because patient is having a history of baby with an anencephalic fetus. Always remember there are the four conditions in which we have to prescribe the high dose of folic acid, and the high dose of folic acid should be prescribed 3 months prior to preconception as well as antenatally. So what are the these four conditions? Neural tube defect. If patient is having a baby having a history with a baby of neural tube defect, as well if a patient itself having a history of neural tube defect or a family history of a neural tube defect, in this condition you have to prescribe the high dose of folic acid. Number 2, if patient is having a history of type 1 or type 2 diabetes mellitus, type 1 or type 2 diabetes mellitus, then we have to have give a high dose of folic acid. Number 3 is if patient BMI is more than 35, we have to have prescribed a high dose of folic acid. Number 4, very important, always remember if they will give you in the statement in the question that patient is on anti-epileptic drug, or they can give you that patient is having a history of epilepsy, then we have to have a prescribed high dose folic acid. High dose folic acid in these four conditions. So what is the dose? High dose, what's the high dose is? High dose is 4 to 5 milligram is the high dose folic acid. This should be started 3 months prior to conception as well as antenatally. So the correct answer is she should use supplemental folic acid 4 to 5 mg per day, because having a patient is having a history in this scenario of anencephalic fetus, that's why 4 to 5 mg per day. Rest all other options are incorrect, because this is for the normal if there is no known condition which we have discussed, the four conditions are not present, these four conditions are not present, we can prescribe a no, this dose 0.5 to 0.4 to 0.5 milligram or 400 to 500 microgram they can give you in the unit. So these is the normal conditions in which we have to supplemental folic acid. This is the normal dose. 10 mg per day is incorrect, because 4 to 5 mg is the high dose which we have to prescribe in these conditions which we have discussed. Green leafy vegetable, we can we will counsel to increase the diet with full of green vegetables, because it contains the folic acid, but it will not meet the requirement. So this is the general advice given to all patients. but patient is having a history of anencephalic fetus, so this is not the correct option. She should use supplemental folic acid 1 mg per day. 1 mg is also not the correct dose here. So let's read the explanation. Correct answer is E, we already discussed. Folic acid deficiency of the mother can result in the fetal neural tube defect, and for this reason, every woman should be started on folic acid from at least 1 month before conception. At least 1 month before conception and continuing during the first trimester. In addition, all women should be encouraged to include green vegetables in their diet at least during this period. Current recommendation is daily use of folic acid 0.5 mg daily or multivitamin containing at least 0.4 mg of folic acid. So we should take 10 times the minimal dose. They can give you this option as well. 10 times the minimal dose, 4 to 5 mg per day. If there is a family or a personal history of neural tube defect or previous pregnancy with anti-D, use of medication that affect folic acid absorption, example anti-epileptic medication, type 1 and type 2 diabetes, mother BMI greater than 35, this we already discussed. So in these conditions we have to give a high dose of folic acid. The important thing is here is at least these dose should be started 1 month before conception and 3 months into the pregnancy. This is the important point here. I hope this is clear. This question is clear now. So as we have solved the last previous question about the folic acid, now please try to solve this question about the folic acid supplementation. A 27-year-old woman present for a pre-pregnancy consultation. She is vegetarian. Which one of the following would be the best recommendation with regard to the folic acid supplementation? A, she does not need folic acid supplementation because she is receiving adequate amount through her diet. B, she does not need folic acid supplementation but she should increase consumption of green vegetables. C, she should be started on folic acid 0.5 mg per day. D, she should be started on folic acid 0.1 mg per day. E, she should be started on folic acid 5 mg per day. We just discussed the previous question and the correct dose about the folic acid. So yes, you all are right. The correct dose is 0.4 to 0.5 milligram. Without any known condition, we have to have prescribed this dose of folic acid 0.4 to 0.5 mg or 400 microgram to 500 microgram in the normal condition. Rest, if the patient is having the condition which we discussed previously, neural tube defect, type 1 type 2 diabetes mellitus, BMI greater than 35, or patient is on anti-epileptic drug, so we have to have prescribed a high dose folic acid.